The governor is stepping up efforts to combat opiate addiction. A new principal is selected for Barnstable Intermediate School, and the State Secretary of Housing and Economic Development is visiting Cape Cod Community College this week. These stories and more on this episode of Barnstable Today. It's Monday, March 31st, 2014. I'm Sarah Mannel. More than 500 people gathered to honor heroes from across the Cape at the 12th annual Cape and Islands American Red Cross Heroes Breakfast Friday morning. Town manager Tom Lynch says the event brings the community together.
First of all, it was amazing to see how many people from Barnstable were represented.
Yes.
And I'd like to go through some of those. But when you look at what folks contributed, Liz Mumford from over in Hyannisport had put together a really nice,
little illustration for the cover, yeah.
And they were giving those out or selling those, well, actually selling those, I guess, and she was autographing them. Of course, Captain Phillips from the Maersk, Alabama fame was there, and he was right on target, kept his remarks brief, but I had a chance, I bought his book and was reading it over the weekend, almost couldn't put it down, and it's really quite harrowing. So it was really, but and he graduated from Mass Maritime.
Of course.
And a lot of it is just, it's like, I think the title might be A Captain's Duty. And a lot of it was just about, ordinary people either training to do things or being put in situations where they need to respond, and they do. And I thought that's what was, so uplifting about this particular event.
A number of Barnstable residents were among the honorees, including Carrie Consalvi of Marston's Mills, Anna Maria Wechter of Marston's Mills, Christopher Bell of Hyannis, Joe Bunshoe of Hyannis, Zachary Hunter of Centerville, Mike McNally of Marston's Mills, and members of the Barnstable Beach staff. Barnstable Public Schools staff are closer to filling several important vacancies. Superintendent Dr. Mary Schakowsky says after working with a search committee, they have selected current Vice Principal Jim Anderson to take over when Principal Karen Stonley retires at the end of this academic year.
Very excited about this choice. I think he, overwhelmingly, I think the search committee supported him in his recommendation to me. And I have met with him on Friday, had a couple of interviews, did some reference checks.
Schakowsky says progress is also being made filling the assistant superintendent position. Schakowsky recommended curriculum coordinator Kristen Harmon take that spot. That recommendation will now go before the school committee for final approval. Cape Cod Community College will host Gregory Bielecki, the State Secretary of Housing and Economic Development, this week. Spokesperson Michael Gross says Bielecki will talk to students about a variety of issues.
And he's going to talk a lot about what is going on in the global economy and the regional economy. He has World Bank experience, really a great deal of information to share with our students. And it's going to be in a very, very wonderful, intimate setting.
Bielecki will be at the Tilden Arts Center Wednesday, April 2nd at 1:30. The event is free to attend and all are welcome. Governor Deval Patrick is taking dramatic steps to curb opiate abuse in the Bay State. Patrick announced last week he is allotting $20 million for drug abuse prevention, intervention, and treatment programs. Barnstable This Morning host Sarah Colvin talked about the new initiative with State Representative Randy Hunt. We share a portion of that interview with you now.
Interesting news, Randy, from the governor's office last week, and what the Cape Cod Times headline says is governor declares war on opiate epidemic. So tell me a little bit about, what kind of decisions he's made and if you feel that's going to help the substance abuse issues that we are facing here in Massachusetts.
Well, it will, and I'm pleased to see that the governor has tuned into this issue. I've complained a little bit before that it seems like the administration didn't seem to get what kind of problem we have on our hands. But now that's clearly happened. He declared a public health emergency, and in that declaration, he called out 4 things that are going to happen. First off, and we've talked about this on this program before, all first responders are now able to carry and administer nasal Narcan. And that is a drug that reverses an opiate overdose, provided that the person is still breathing. And it's an amazing way to get somebody essentially directly into a withdrawal from being on an overdose. Police were not able to do this before except for certain pilot cities. And the issue is that they're often the first ones on the scene, and they were not able to do this, even though, like in Yarmouth and Mashpee, they were trained to do it, but they couldn't carry and use it because of rules and regulations that the Department of Public Health had. So number one is they stripped that away. It is now under this 90-day public health emergency. They can carry it, and a week from tomorrow, the Public Health Board is going to approve the regulations so they'll become permanent. The second thing is there is a new drug that was okayed by the FDA called Zohydro, which is a pure hydrocodone medication for pain, and it was passed by the FDA in spite of the fact that their advisory council voted against it 11-2. And the problem that we have is that it is like OxyContin on steroids. So we, in the right circumstances, I'm sure it'll be a lifesaver for people with serious chronic pain. But on the other hand, we wanted to take a pause in Massachusetts to make sure that this wasn't going to get diverted onto the street and end up becoming a nightmare like OxyContin has. So that drug has been put on hold in Massachusetts, first state to do that, until we can figure out how to handle it.
Right, and I think that's very important, as we've seen. You know what really what happened with the OxyContin and the oxycodone, those pills, and how that translated into people going from taking pills to using heroin to dying and overdosing. Certainly, we don't need any more powerful painkillers like that out there on the streets, I think.
I agree. This goes under the category of been there, done that. So let's not do it the same way again. The third item is that the prescription monitoring program, and we've talked about this also, in July of 2012, we passed a law that required all physicians and other people who prescribe opioid drugs be signed up on their regular licensed renewal period over the next 3 years. So this public health emergency says, no, we're going to accelerate that, and everybody who prescribes needs to be in the prescription monitoring program by the end of this calendar year. So that's good, too. And finally, the fourth thing that happened was I'm particularly pleased that essentially the Assist Act that I've been pushing as a bill in the State House that we've talked about a number of times as well is going to be put into play by the Interagency Council on Substance Abuse and Prevention, of which I'm a member, to over the next 60 days to try and come up with ways that we can deal with the overdose epidemic and the drug addiction issues that we have to date. And it is going to be tasked with a few things, not limited to, but how to better coordinate services amongst addiction providers, ensuring full range of treatment irrespective of insurance arrangements of the person getting the treatment, and how to divert nonviolent criminal defenders struggling with addiction into treatment programs as opposed to having them go into incarceration, and that is really the crux of the Assist Act. So I feel pleased that has all taken place as part of this, and there's no better way to get a piece of legislation passed than just to skip over the whole process of getting it through the legislature and have it put into effect by the governor with an emergency health proclamation. So that's great, and I look forward to those meetings and coming up with ways that we can try and get our hands around this addiction epidemic.
And be sure to tune in to our hour-long daily news program, Barnstable This Morning, on weekday mornings starting at 7 a.m. Coming up on tomorrow's show, we'll talk with Police Chief Paul McDonald and much more. With Barnstable Today, I'm Sarah Mannel.